So it is 9:06, so we are going to get started. So good morning and welcome to our March Student Support Series webinar, supporting anxious students, practical strategies for schools. As many of you know, my name is Kate Bohannon. I'm an associate education consultant with the State Department of Education. I'd like to give a thank you to CERC for doing our tech support and registration for us. As I mentioned before, cameras and microphones are disabled. Please use the chat for any comments and the Q&A function for questions. We're going to try to save questions to the end, just to ensure that we have time for all of the content. But in order to make sure they don't get lost in the shuffle again, please put your questions in the Q&A and comments in the chat. This webinar will be recorded and available on the Student Support playlist on YouTube. Again, please be mindful of confidentiality. We want you to be able to ask your questions, but noticing that we do have a large audience, that you're not using any identifiable information. If you're having tech issues during the webinar itself, please send a chat to CERC in the chat feature here, or you can email Linda Adorno at CERC. This webinar has been approved for 1.5 continuing education credits through the NASW Connecticut. The approval meets continuing education criteria for LCSW, LMSW, LMFT, LPC, and licensed psychologists. If you are joining us from another discipline, you are welcome to request CECs. However, it is your responsibility to confirm whether or not your professional organization or licensing body will accept that certificate. We also provide a certificate of attendance, which is in some cases sufficient. At the end, I will share a link and there will be a QR code for the CEC request form. Again, I like to ground our work here in who we are and who we're doing this for. So just a quick look at the breakdown of our students in Connecticut, our schools, and who we are as school mental health staff. So this is some recent data that is hot off the press from the 2025 Connecticut School Health Survey, also known nationally as the Youth Risk Behavior Survey. For those of us who joined us this fall, you may remember that we had Adora from DPH present on the 2023 data. But now this 2025 data will be publicly available in the next coming weeks, but we did get a sneak peek here. So just wanted to give some updated information about, again, this is for high schoolers, but who reported that their mental health was most of the time or always not good. You can see that the numbers, the percentages from 2023 to 2025. The good news is that that percentage is going down, but it is still pretty high, 20% or 21%. So about a fifth of our students here are reporting that in the last 30 days, their mental health was most of the time or always not good. And then when you look below, of those students who identified feeling sad, empty, hopeless, or anxious during the 12 months before the survey, again, only about 21%, 22% of those students felt like they got the help that they needed. So I think that's really important to keep in mind as we discuss today's topic, particularly as anxiety is so prevalent with our youth today, and that impact on them as individuals in their education, but also the school setting as a whole. So I'm so excited to have Dr. Rebecca Etkin join us this morning. Dr. Etkin is a licensed clinical psychologist and associate research scientist at the Yale Child Study Center Anxiety and Mood Disorder Program, where she studies and treats anxiety disorders and related difficulties in children, adolescents, and their families. Dr. Etkin has numerous peer-reviewed publications, and her research has been funded by organizations including MQ Transforming Mental Health and the Mental Health Research Institute. So thank you again, Dr. Etkin, for sharing your insights and expertise this morning. And without further ado, I will pass it over to you.
Wonderful. Thank you so much, Kate. It's really a privilege to be able to present to this group, and I'm honored to have been invited. So thank you again, and thank you to everyone who logged on this morning. I'm blown away by the numbers of people on this webinar. Okay, so I'm just going to bring my slides up and go ahead and share them. All right. think we are in good shape. It's always a little bit of a gamble with Zoom, right? Even all these years after using it. So yeah, Kate already gave my introduction. But I am, I'm at Yale. I am a research scientist primarily, but I do very clinically oriented research with youth with anxiety and related challenges. And really, we have a strong family focus in our program at Yale. So we do a lot of family-based work, a lot of work with parents because, children do not grow up in a vacuum. Their parents have a strong influence in their lives and a strong capacity to really help them navigate challenges. So you'll sort of hear that theme sprinkled throughout my talk today. But we are going to be very focused on schools and what can sort of be done to help this large swath of anxious students that we all see. Just a few disclosures. I do receive some grant funding, as Kate noted. I received some compensation related to training and consultation and teaching on the approach I'm going to be talking about today. That's called SPACE. I'll get into that in more detail. And then my final disclosure is that I unfortunately, like probably many of you, am under the weather this morning. And so if I ever mute myself for a moment or turn away from the camera, it's just because I'm maybe trying to get through a coughing fit. Hopefully that does not happen. But again, I'm sure many of you are in the same boat. And hopefully spring is coming soon. Okay, so just to set the stage for this talk, I'm going to start by stating what's probably the obvious, which is that anxiety is very prevalent, but part of the reason it's so prevalent is because at its core, anxiety is just a natural human emotion slash experience that we all have sometimes. So why do we have anxiety? It's really like biologically ingrained that we have anxiety because it has an adaptive function to it. Anxiety serves to alert us to potential problems or threats. I think sort of like a classic example we use with kids sometimes is, um, if like a tiger jumped into the room and you didn't have any anxiety or a fear response, like how would that work out for you? Right? Like probably not so well. We need that anxiety response to come online to trigger us into action, right? Namely, like the fight or flight response. It would probably be very helpful to run away if a tiger jumped into the room. So we need anxiety, right? It's very adaptive and normal to have it. Um, and for most of the population, including the adult and the youth population, anxiety is something that's experienced as transient, meaning, it comes and goes, right? We have it, it passes, it doesn't stick around too long. And it's also experienced as somewhat tolerable, like, oh, anxiety doesn't feel pleasant, but, it's okay. It's not the worst feeling that we have. But this is not the case for everyone. Actually, for quite a large number of folks, as again has already been alluded to, anxiety can become really problematic or can escalate to what we would consider a clinical anxiety disorder. Okay, so I'm not going to spend this talk sort of like doing anxiety 101. I'm going to assume some shared knowledge about anxiety and its disorders, but I will highlight a few things. One is that when we're diagnosing anxiety disorders in kids, we're looking for that anxiety that is really frequent and persistent, right? It's not that transient anxiety. It's much more sticky. It's coming up at least multiple days a week, and it's hard to sort of control or dismiss, right? Um, in kids with anxiety disorders, we're also talking about a level and type of fear that's out of proportion to the situation. So, if a child has fear about a a present and very real threat, right? Maybe that's anxiety, but I don't necessarily know if it's an anxiety disorder, right? So if a child is like very much being bullied or experiencing violence at home or in their community, like I don't think anxiety is the only thing going on here because there's a real threat that the child's reacting to. And again, it doesn't mean that they're not having anxiety, but it's very different from the child who, gets straight A's in school and is constantly worried that they're not going to get into college one day. So this is something that we're often thinking about, how proportionate is the fear to the situation. Of course, there's a lot of significant personal distress that can come along with an anxiety disorder, right? It's not just like, oh, this feels unpleasant, but it's leading to like crying, trouble sleeping, those like physical aches and pains and discomforts. And perhaps most importantly, or at least this is what we're most concerned about in our program, is the interference that the anxiety causes in day-to-day life. Anxiety is not so problematic necessarily unless it's getting in the way of things that you need to do and things that you want to do, right? It's messing up your friendships, it's messing up your ability to go to school or participate meaningfully in school. That's when we, I think, start to pay attention. And that's often what brings families in for treatment, right? If their child has some anxiety, but it's not messing things up, we're probably not going to see that family. But to the extent that it's starting to interfere, okay, then we think maybe we need to treat these kids. Um, so this level of anxiety, right? Kids with anxiety disorders still super, super prevalent. There is some epidemiological research that shows that in the United States, up to 30%, 1 in 3 kids, based on their symptomatology, would meet criteria for an anxiety disorder at some point by the time they're 18. It's a really big number, in my opinion. Um, and what the research does consistently show too is that anxiety disorders as a class of disorders, and there's, heterogeneity in the types of anxiety disorders, but taken all together, they are more prevalent and more common than other really common mental health diagnoses like behavior disorders, mood disorders like depression, and substance use disorders. Anxiety disorders also onset the earliest compared to these other disorders. So we usually see anxiety disorders emerging for the first time when kids are just between 6 and 11 years old. So again, usually like sometimes we talk about in our program at least anxiety almost being like the gateway disorder, right? Like kids start with some anxiety when they're younger, and then if it's left untreated, it can cascade into the development of other challenges, right? And to me, it makes sense intuitively. If you're a kid who has like struggled with anxiety from the time you were 6 years old, eventually you might start to experience some depression because the anxiety has messed up your life so much. It holds you back from doing what you need to do, what you want to do. It causes all this personal distress. Eventually, we might start seeing some depression come in or some substance use to try coping with those symptoms. So, again, intuitively, it sort of makes sense why we see that sort of cascade effect that kids start with experiencing anxiety and then it might go on to more serious disorders if it's left untreated. And by the way, anxiety disorders do not tend to spontaneously remit. I think that is a misconception that we sometimes see. I'll work with parents of maybe a young kid, a 6-year-old with separation anxiety, and they'll say, oh, it's just a phase, it's going to pass. Probably not. Like they might not have separation anxiety forever, but will that morph into some social anxiety, some more generalized worries? This is what the research shows, and this is what we see clinically. Um, of course, there are also a lot of comorbidities with anxiety. It's not just that anxiety can cascade into other more serious difficulties, but we see a lot of comorbidities, and I'm sure you all see this, right? Kids with anxiety also often have ADHD, autism, learning disorders, things like this, and they can become very entwined and entangled and sort of exacerbate each other in really complex ways. So, um, Kate had shared this survey, which I read with great interest. The Connecticut Education Association did a back to school survey where they asked about 1,000 teachers across Connecticut about a variety of topics going into the school year. And yeah, I was interested and also sort of unsurprised to see that increased stress and anxiety was among the sort of top behavioral concerns or challenges they were seeing in their students going into the year. So, this research is not just at sort of a national and global scale. We're seeing it right here in Connecticut, of course. So, uh, we need to pay attention to anxiety. We need to treat it. There's some good news here, which is that there are, of course, effective treatments for youth anxiety disorders. So a lot of research that's been done on, what's an efficacious approach to addressing anxiety disorders in the pediatric population. And overwhelmingly, what this research shows is that cognitive behavioral therapy, or CBT, which really, by the way, is like an umbrella term that encompasses a lot of related therapy approaches, but sort of any type of therapy that is helping youth reframe their anxious thoughts, doing cognitive restructuring, looking for thinking traps, and also taking that behavioral approach of facing your fears, right? Engaging in exposures of anxiety provoking situations. Those CBT approaches are found to by far be the most effective, efficacious for treating youth anxiety, and also medication, namely SSRIs, right? These are considered like well-established evidence-based approaches. But when you look at the literature overall, meta-analyses of studies examining, CBT, medication, their combination, what that research reveals is that about 50% of kids who get these top line treatments fully can overcome their anxiety disorder. They reach remission from their anxiety disorder. Now that is a little conservative because that doesn't include, the kids who experience some remission or some relief from their anxiety when they get these gold standard treatments. But 50%, if you're a glass half full person, that's great. If you're not a glass half full person, we have some concerns here because what we see is that there's a gap, right? There's a big group of kids who again get the best treatments that we have, and they're still experiencing like pretty significant anxiety. So this raises a first point that maybe what we need is more efficacious treatment options for anxiety disorders. Treatment therapy, as you all probably know, is like not a one size fits all. CBT medication, that's not going to be a fit for every kid. But again, the research shows these are the best treatments we have, and they don't work for everyone. So that's point number one. A second point is that, that 50% of kids who really like benefit from CBT and medication, that 50% is only considering the small sample of kids who are willing or able to engage in or access those treatments in the first place, right? So let's put the issue of access aside because that's a different talk, right? Who can access the best treatments? But let's say you can, right? Let's say a child and their family can pursue CBT. Their CBT requires a lot of a child, right? It requires they attend session, they comply with all of the different tools that are being taught to them. there's homework often in CBT, right? They have to be practicing these tools throughout the week. Even with medication, you have to follow through. There's some compliance needed. Um, and not all kids are going to be willing or able to do that, right? Again, I'm sure we all in this audience know this, like we've all worked with that kid where they just simply can't engage meaningfully with treatment. And then it's not going to be so effective. And so a second point is not only do we need, additional treatment options that sort of differ, they represent maybe a paradigm shift from the sort of classic model of you come in and talk to a therapist and learn skills and then you have to practice skills, right? Like we need something else. Um, but right, it really has to like be meaningfully different to help these kids who just maybe CBT or medication or related treatments aren't a good fit for them. So this brings me to the treatment approach I want to sort of focus on today, which is called SPACE. SPACE stands for Supportive Parenting for Anxious Childhood Emotions, which is a big mouthful, so I'm just going to say SPACE. Um, SPACE was developed by my mentor and now my colleague, Ellie Leibowitz, who is with me at Yale at the Child Study Center. He developed this treatment a little over 10 years ago, and it was really based on this like gap, this glaring gap that he saw. How do we help these kids who are still really struggling with anxiety and just either CBT isn't like a good fit for them or they're just not benefiting enough from it. This led him to develop a fully parent-based treatment for pediatric anxiety disorders and for OCD. OCD, of course, has its own special place in the DSM now, but for all intents and purposes, we can really consider OCD an anxiety disorder. There's a lot of overlap between those classes of disorders. And what I mean by a fully parent-based treatment is like the kid does not need to present in session at all. Ideally, we assess them. I'm not talking about assessment in this presentation. We think assessment is very important and it's the foundation of good treatment, right? If we don't really have a good grasp and conceptualization of what a kid is struggling with, how are we supposed to recommend the best treatment? So we are firm believers in assessment. I just don't have time to talk about it. But we think that aside from assessment, it is possible to treat a child's anxiety or OCD completely, right? To the point of remission just by working with and sort of through their parents in session. So this to me as a therapist was like an absolute game changer. Again, a real paradigm shift for how we're used to working with kids, which is directly with them, right? At this point, in terms of the research base, there is a lot of accumulating evidence showing that SPACE is effective in treating anxiety and OCD. The largest randomized controlled trial to date actually showed that when you just work with parents doing SPACE, we saw equivalent outcomes for when a therapist just worked with a child doing CBT, which again is quite remarkable, in my opinion. So what that to me also represents is that here's like an alternative treatment, right? Like if SPACE is just as effective as CBT, it could be a good fit for those kids for whom CBT doesn't really work or they don't really want to engage in it or feel like they can't. But it's not enough just to say like we need more treatments and maybe like let's work with parents. Like there's like a reason why Ellie thought we should work with parents. And there's a really like a firm theoretical foundation behind SPACE and why we're doing this parent-based work, specifically for kids with anxiety and OCD. Um, and really what it stems from is attachment theory, right? What we know from like decades and decades of attachment theory and research is that children, including adolescents, I'm just saying children throughout this presentation for simplicity, but children, when they feel threatened, when they feel scared, it is ingrained, right? It is just biologically ingrained to seek out their parents or their caregivers for comfort, for protection, for nurturing, for soothing, right? From the time they're born, this is part of the attachment relationship, right? That very early work on attachment conducted by like Harry Harlow, maybe you remember it from Psych 101 with the experiments with the monkeys, right? Which were really like sad and kind of unethical, but showed us something really interesting, which is, when you separate a baby monkey from its mommy and raise it in isolation and expose it in these early experiments, right, to a fake mommy that was like sort of warm and cozy and covered in cloth and kind of looked like a monkey versus um, sort of like a monkey that looked not very comforting, like it was made out of wire, but it had some food attached to it. When the baby monkey was scared or threatened in these experiments that they did, they ran to the warm, fuzzy, comforting mommy monkey, not the one with food. So those early experiments showed that, again, there's this kind of like very ingrained attachment response in young mammals where they're going to seek comfort and protection from their parents when they're threatened. So, okay, at a risk of feeling like I'm going off on a tangent here. Let's take this back to kids with anxiety disorders. The key feature of anxiety disorders in kids is constantly feeling threatened and scared, right? And so, what are kids going to do when they feel this way? Of course, they're going to run to their caregiver, right? It's different than just like the classic fight or flight response in adults. Or if I feel threatened, I can run away or I can lash out, right? Kids are not just running away, they're running to their parents. And parents, in turn, are hardwired to respond to this, to pick up on these signals and cues in their child and jump in and protect their child, right? And provide nurturance and support and comfort and keep them away from whatever's threatening for them. So, this is a very natural response system between children and their parents, again, rooted in attachment theory. But this is very good, right? Like I want to be clear. This is good that this like attachment system works like this, that when a kid is threatened, they are sort of instinctually going to run to their parents are going to swoop in and protect them. Except again, when you have an anxiety disorder, you are chronically feeling like you are in threat, even maybe when the threat is very diffuse, hypothetical, future oriented. And so what can happen is that parents of anxious kids can become very, very, very entangled in responding to their child's anxiety, even again, maybe when there's not like a real and present threat. And this can also become very, very, very frequent. So we have a word that we use to describe this phenomenon of this like entanglement that parents feel in their child's anxiety. And we call this accommodation, family accommodation of anxiety. How we define this is basically any changes that family members, mostly parents slash caregivers, but other family members too, changes that they're making to their own behavior to help sort of prevent or alleviate their child's anxiety and related distress. So, for example, if your child is feeling anxious and they come to you, let's say they're anxious about a party you're going to, right? Let's say they have some social anxiety and they come to the parent and they have a million questions because of that anxiety. Who's going to be there? How long are we going to be there? Will you stay with me the whole time? And they're asking these questions over and over. How does a parent accommodate that? What's the sort of equivalent of swooping in and protecting in that moment? Well, answering the questions. So and so is going to be there. We're going to stay this long. Of course, I'll stay with you. And maybe we're engaged in that cycle of questioning and answering for quite some time, or it pops up numerous times before the party. Maybe a child with, a fear of the dark or some separation anxiety, gets really scared at night and says, Mom, you have to sleep with me. You have to stay in here. And so, what does the parent do? Of course, they're a good parent. They're hardwired to respond. So they swoop in and they say, okay, I'll sit with you while you fall asleep. And again, maybe that becomes a pattern, or it takes up to 30, 40, 60 minutes each night. Um, Parents also accommodate by sort of modifying their schedules or routines in a lot of ways. Some families we work with, they keep a very, very strict schedule because any deviation might upset their child, make them anxious. And so, okay, we have to stick exactly to our rigid schedule. Or maybe, if a child has a lot of anxiety at school, parents are leaving their work early to pick their child up early, right? Again, it's that natural sort of systemic process playing out. I'm scared. I reach out to mom. You have to pick me up. Okay. I'll protect you. I'll swoop in. I'll come pick you up. So again, this is very normal, but it can become very problematic for families and for the child's anxiety, right? So family accommodation is so well intentioned. Families we work with are literally bending over backwards sometimes to accommodate their child. Um, but now, over the years, like hundreds of research studies have accumulated showing that family accommodation does not always help in the intended ways, right? It's intended to alleviate the anxiety, to take it away, to make the child feel better. That's not what we're seeing. What we're actually seeing in the research consistently is that the more that families are accommodating, the more anxious their child is and the more impairment there is related to the anxiety. So, why is that the case? We can consider this cycle, okay? There's some distress related to the anxiety disorder. Again, let's say there's a child with some separation anxiety. Let's say they have to go get their backpack in their room before school. So, what do they say? Mom, I'm scared. I can't go get my backpack. It's in my room. What does the parent do? Probably, okay, I'll go with you. Why do they do that? A few things. One, they're trying to make their child feel better, maybe. And also, like, for practical reasons. We got to get to school. I got to get to work. The bus is coming. Like, it's hard not to accommodate. There are consequences to not accommodating. In the short term, this works quite well often because the child feels better. They get their backpack. Everyone can get to school and work on time. But what happens over time? And the child is learning a lesson each time their parent accommodates, right? Which is like the only way I can cope with my fear and be okay and get through things is if my parent helps me, right? If they accommodate. And the parents learning a lesson too, by the way, which is like the only way my child can be okay is if I swoop in and I accommodate. And this can really, again, lead to maintenance of this cycle of accommodation and anxiety over time.
Can I just jump in with someone brought
Yes.
up a good question, Gwen, in the chat there. And I think it goes into that, the maintenance of symptoms is
Mm,
parents' own anxiety and that impact
yeah,
on this cycle and on their children.
100%. Yeah, we feel, I should say, saying we feel is a little weak. We know for a fact that parents do not cause their child to have anxiety. Okay. Like this is such a common misconception. And that's just because why one child develops like an anxiety disorder is so complex, right? It's due to sort of a mixture of like a biological and genetic vulnerability and also environmental factors, maybe including parent influences and parent anxiety. But I think it's such a dangerous message to send to parents that like you made your child anxious. And I think there are a lot of misconceptions in our society in general that like parents, can really cause these issues in their child directly. Um, but of course, anxious children tend to have anxious parents and vice versa. Again, because there is such a strong like biological and genetic component. And of course, parents who tend to run a little more anxious themselves might be more inclined to accommodate their child. But that's okay. Like understandable. And when we work with families doing this space approach, for example, we can address and acknowledge that and totally like validate it. Like, of course, like for you too, like it's hard to watch your child struggle. It raises your own anxiety. Maybe you have some worries too that your child isn't really capable of doing certain things on their own or has more challenges than other kids, and that's going to influence your own behavior and reactions. Like all that makes sense and is normal. Um, and still we can work on it with some really practical strategies. And a cool thing about space is that even though it very much is a treatment for child anxiety, the child is the patient when we do space, even though we're only working with parents. A beautiful cherry on top that our research has revealed is that parents who go through space also experience reductions in their own anxiety and stress. And I think it's because, again, well, a few things, when they're learning tools to help their child, they're probably inherently going to apply some of those tools to themselves, right? And have some of those takeaway messages themselves. But also, if they can see that their child is getting better, that's of course going to alleviate some of their own stress and anxiety. I had a supervisor say to me once, like, parents are only doing as well as their least well child or something like that. It's like when your child's struggling as a parent, you're going to feel like you're struggling too. Um, so again, to see your child doing a little bit better is going to alleviate some of your own stress and anxiety. So again, parents and children they're such a system. They're going to influence each other. Parents' anxiety is going to influence their child's anxiety. Their child's anxiety is going to influence their anxiety. And I think this is like the heart of space. This is what the treatment really helps to get at. So thank you for that question. Um, so in space, we have, two main treatment goals based on sort of this understanding of the parent-child system, attachment theory, family accommodation. One goal is to identify and systematically and very gradually decrease what feels to be unhelpful family accommodation of anxiety. The other main goal is to increase what we refer to as supportive responses to child anxiety. Both of these goals only require that parents make changes to their behavior and engage in what we refer to as unilateral steps or sort of one-sided action to help their child. So we don't ask the child to do anything directly or change their behavior directly in space. Um, Now, each of these main goals is broken down into many like specific steps that are much beyond the scope of today's presentation to cover. But if you're interested in learning space as an approach in working with families, I will show some resources at the end that point you to how to learn the approach. And the other reason I'm not going to go through it in a lot more detail is because we have to pivot to the school context here. So I've given a lot of background, but the reality is we're here to focus on school-based strategies for supporting anxious kids today. And it's so important because the reality is in the US, if kids are getting any mental health services at all, most of them are getting them through schools. That's what this graph is showing. This is stemming from a meta-analytic study that included over 150,000 youth from across the US. And this kind of depicts, one metric of like where they get their services from. And schools are just slightly edging out like regular outpatient uh, clinics for getting therapy. So it's really, really important that we have good strategies in school to address anxiety. That's why we're all here. Now, what is currently being done in schools? I think all the stuff that's like currently being done in most outpatient settings, right? Which is child-focused work, maybe sort of informed by CBT. Here's an example of like an intervention we often see in schools. This might be baked into Ashley's IEP for her anxiety, that if she has social anxiety, maybe she'll have some very CBT oriented exposure type goals, right? I'm working towards raising my hand, asking questions, right? But these are all strategies that we're putting on Ashley. these are great strategies, and maybe Ashley's able to engage in them and really benefit from this type of exposure. That's what this is, right? Um, but again, that's not going to be a fit for all kids. Some kids are not going to engage in these kinds of contingency systems. We also see a lot of other work in school that again is just like very child focused, and that makes sense, right? Like we're working with kids in school. The kid has the anxiety, it's just so intuitive to work with them. So, kids are meeting with all of you and you're providing wonderful coping strategies and again, maybe other CBT informed strategies like looking out for thinking traps, challenging their thoughts, relaxation. All of these strategies can 100% be great. They're not going to be a fit for all kids, or maybe it's just not enough. Maybe we need some additional strategies. What can schools and particularly teachers do? Right? It's great when a kid can work with a school-based mental health provider and really benefit from that. But teachers are also the ones, on the front lines with kids. And there's a lot of other research I won't present, but basically that shows teachers want strategies, they want tools, but they want strategies and tools that actually fit into their real lives because teachers are famously sort of overstretched, under-resourced, underpaid, right? They have so many demands on them. And so we need strategies that are practical and are doable, but still are grounded in evidence and science and maybe have a chance of really helping kids. So, what I'm going to present now is how we sort of take some of these principles and strategies from space and apply them to the school context. So, some of this can certainly be useful for you all, I think, right? Mental health providers in schools, but I think also for teachers. So keep that in mind as I'm talking through these strategies. And what I'm really going to focus on is sort of those two main tools in space that I just gave an overview of. One is increasing what we refer to as supportive responding or supportive messaging to anxious students. And then also really thinking critically about accommodations in the context of schools. Okay. So to start out, I want to take a look at a little vignette about a teacher who we'll call B and her student we'll call Nasir, to think about a really typical situation that might play out with anxious students. This is a story I've heard many times before. So this is a lot of text, so I'm just going to go ahead and read this, and then we'll sort of keep this in mind as we go through the different strategies. So B was an experienced middle school teacher. She had taught so many students, she felt like she had seen it all. But B was still impressed by Nasir. He clearly spent a lot of time on all of his assignments. He was meticulous about getting everything done on time and perfectly. So she was not surprised when Nasir approached after class now and then to ask a question about an assignment. But over the school year, it seemed like Nasir was asking these questions more and more, and she had to spend more and more time answering him. By the end of the first term, Nasir was coming to her after every single class, and his questions were also getting odder. At first, he would ask about something that really was unclear to him, but now he was confirming things even that were already clear or that he knew perfectly well, asking the same question multiple times. And his questions began to become problematic for B, who needed the time between classes to prep or take a much needed break. But when she tried to suggest that Nasir limit his questions, he teared up and looked so embarrassed and worried that she quickly took it back, saying, "Okay, don't worry. I'll be happy to answer all of your questions." So Nasir seemed relieved at that and even seemed to try to ask her fewer questions over the next day or two. But by the end of the week, the questions were back full throttle and even getting more repetitive and time consuming. So, since this is a webinar and not a more interactive presentation, I won't ask you all what you kind of think is going on here, but I encourage you to think about it. My take is that Nasir is probably a student who is struggling with some significant anxiety. I have a few hypotheses about what type of anxiety it could be. This could be a child with more like generalized anxiety, right? He just has a lot of sort of perfectionistic worries. He really doesn't want to make a mistake. He's really worried about his performance, about his future, right? And we often see these kids with GAD asking a lot of questions, seeking a lot of reassurance. This could also be OCD. A lot of kids with OCD have sort of these like doubting obsessions, right? If you work with OCD, you know they question themselves a lot. Wait, did I understand that assignment? Did I get it right? And they have to ask again and again and confirm and check and recheck. So he could have maybe one of those disorders, maybe both. That's kind of the flavor I get of what's going on here. Um, you also can start to hopefully see, uh, you know, B's role in this, right? Whenever a child has an anxiety, there is usually an adult on the other end responding to that anxiety. Because something to keep in mind is that, kids don't only have an attachment response to their parents or caregivers. There's a lot of literature too about attachment to teachers, right? The teacher-student relationship can also have that attachment quality as well. And so, in a context where his parents aren't available, who's this year going to go to sort of get that protection, that soothing, that nurturance? His teacher, right? And it's wonderful that B can sort of be that safe place for him, but we'll have to come back to this vignette and keep it in mind to see sort of, is this the most helpful situation that's playing out, and what can we do to better support Nasir? So what does anxiety look like in school? I mean, you all could tell me better than I can tell you, but I think something just important to keep in mind, and especially in the case of Nasir, is that like anxiety has many faces. Sometimes we like refer to it as the great masquerader. It can sort of like present as many different things. So I think initially for B, she just saw Nasir as like one of those really great, like conscientious, high achieving students. Like maybe she didn't automatically think anxiety, right? He's just a kid who wants to do well. He's very high achieving. Um, but we often see anxiety looking like this, like that very perfectionistic kid. Again, that kid who never wants to make any mistakes. For Nasir, seeking a lot of frequent reassurance and assistance. But, we see it present in other ways too. Um, there's that sort of more quiet, conscientious, eager to please kid. And then sometimes anxiety presents more as like the fight aspect of the fight or flight response. We see kids who lash out, who are oppositional, argumentative. And again, on the surface, maybe to many teachers, especially who might not be as well versed in anxiety, they might not see it through that lens at first, right? Or the kid who always like is sick, right? The kid with a lot of somatic complaints. We might not see that through the lens of anxiety at first, but kids who often have a lot of headaches, stomach aches, need to go to the nurse all the time. These are our kids who have often like some separation anxiety, some social anxiety, and they're really experiencing that physically. So we always have to ask, right? With any behavior we see in the classroom, could anxiety be part of the picture? Maybe it's not, right? All these things on the screen maybe could be explained by something else instead, right? Like a kid who like refuses to transition or has a lot of transition difficulty, um, that could be explained by anxiety, could be explained by something else. Maybe it's a kid who's on the spectrum or just like a kid who's very rigid, right? So it's not prescriptive, right? When we see these types of behaviors, but anxiety should always be like a question mark. It should always be on the table to consider. And that can help us to be more supportive, to respond more supportively if we think, maybe anxiety is part of the picture here. So I already said that expressing or increasing support is a main pillar of space. It's one of the tools that we emphasize the most. Now, support is a very generic word. It could mean anything, right? But in space, we mean something very specific. when we talk about support. What we mean by support in space is when caregivers, in this context, teachers or school-based mental health providers, express an integration of acceptance or validation of the child's anxiety. So like I understand that anxiety is real. It can feel very hard. You can't just choose not to have anxiety, right? Maybe just because this isn't hard for another kid, it's hard for you. So genuine acceptance integrated with confidence, which in space we really mean to express a confidence that the kid can handle, can overcome, can cope with, can merely even tolerate or survive anxiety, right? It's not confidence in the way we typically express it, which is like, oh, I'm sure you can do your assignment. I'm confident you can ace the test. A confidence expression in space is really, again, more about handling or being okay despite having anxiety. You can have anxiety and be okay and get through it at the exact same time. So, putting it all together, it might sound something like this. I know that presentations make you nervous. That's understandable. Many kids feel that way. And I believe you can handle that feeling, right? The nervous feeling. We can use this kind of supportive response with kids with of all ages, little ones through high schoolers. Um, I've talked to many teachers, nurses, again, people like on the sort of front lines with kids day in, day out, and they like this tool because it's so simple, right? Often they're trying to respond to anxious kids in so many ways, right? To talk them down from their worries, to tell them, oh, you don't need to worry, to explain to them why their worry is unfounded, right? And they can get stuck in these loops. And with a supportive statement, it gives them something consistent to say every time that's simple, but really sends an important message that kids need to hear. Um, we sometimes like to, to get this on a more practical level, we sometimes compare supportive statements like this to mac and cheese, because mac and cheese is like the simplest two-ingredient recipe you can think of. But it has to have both ingredients to be mac and cheese, right? It has to have the pasta, it has to have the cheese. And so with support, it's important to remember that it needs to have both acceptance and confidence. If you're missing one, it's not supportive in the way that we mean. Why does expressing support matter? I think support is a tool that is like deceptively complex or deceptively simple, whichever way you want to think about it. Um, on the surface, when we first teach it to parents, to teachers, to respond to kids in this way, they might say something like, oh, yeah, I basically already say something like that. They probably don't. We don't intuitively say this combined statement to kids. Often we're saying one or the other, right? We're saying something just validating. I know it's so hard. You're going to be okay. Or we're saying something um, that might, intend to be a little more confident, but sometimes can cross over into what we refer to as like more of a demanding response, which is like, it's fine, don't worry about it, or like, it's not that bad, right? Like, these are things I've said these things, to my kid. And it's just like, the problem is, what parents or teachers mean to say is like, really, it's not that bad. Like, you don't need to worry about this. And they say it in a very well-intentioned way. But what the kid is hearing is maybe something invalidating, right? Like, oh, I shouldn't be feeling this way, or I should be able to turn off my anxiety, but I don't feel like I can. And that can kind of make things harder and worse. Um, so why do we want to say this supportive statement? When kids turn to someone important in their life, like a parent, like a teacher, right? Teachers matter so much. When kids turn to these people in their life, and what they see reflected back is a kid who is experiencing some challenges, but is still capable, is still resilient, is a kid who can handle challenges. that's what they will start to believe about themselves, right? If what they see instead is, every time they go to their parent or their teacher and what they get reflected back is like a kid who's kind of vulnerable, kind of can't handle things very well, like that's what they start to believe about themselves. And a kid who internalizes this idea, like, yeah, I get scared sometimes, but that's okay because I can handle being scared. That is the key to unlocking their anxiety. Because the problem is kids get stuck in anxiety and experience clinically significant anxiety because they think that they can't handle it. Because anxiety is something threatening, something to be avoided. It's not safe. It's not okay. So, what do? I do everything in my power to avoid having that feeling. And then my life starts to shrink. School makes me too scared. Scary feelings are bad. They're unacceptable. I can't have them. I shouldn't have them. So, let me avoid school, right? And once kids have the opposite perspective, it's okay to have some anxiety. Anxiety is something that passes, it's something that's safe, it's something I can handle. Then they might start approaching more situations where anxiety might pop up. And again, that unlocks the whole thing. That's the key to escaping your anxiety disorder is being able to approach situations that are scary. That's the whole point of exposure in CBT, right? Um, and we can sort of achieve that same outcome just by working with the most important adults in kids' lives and kind of helping instill this belief through repeated, consistent, supportive responses. So it's a beautiful tool as well because now every time, your student is anxious, it's not a problem, it's an opportunity. It's an opportunity to express some support and show them that anxiety is actually something that's okay and something that can be tolerated. Um, so here are just some more examples. Um, let's say a child has some social anxiety, they're scared to join others at recess. So it's sort of maybe a more protective slash like only validating response. It's like, oh, it's okay, it's scary, you don't have to go, you can sit out. Maybe a more demanding kind of style response is like, oh, it's not that bad. Go join the other kids, right? Neither of these capture the full picture, right? The demanding response kind of doesn't acknowledge how hard the anxiety actually really is for the child in this moment. And the protective response doesn't give the kid any confidence. It doesn't send a message about our ability to cope with and overcome and move through anxiety. So, a more supportive response might be the teacher saying something like, I know it's so hard. I even get scared joining groups sometimes too, but I believe you can handle hard feelings. I believe those scary feelings can get easier, right? And maybe in the moment the kid doesn't believe you, they say, no, I'm still scared, I can't do it. That's okay. A supportive statement is not a pill a child has to swallow. It's a tool that an adult can use. It's a step, it's a change they can make to their own behavior responding this way. And if a child doesn't agree with it or is still struggling, the adult can say, okay, well, that's what I believe, right? I believe you can handle it. And maybe the message is still sinking in. Just because a child doesn't change their behavior immediately or express agreement immediately, it doesn't mean that message isn't sinking in, especially if it's given consistently. Um, Again, we briefly touched on the fact that there are lots of other great tools that are being used in school, maybe by many of you all, to help kids kind of tolerate or cope with their anxiety a little bit better. And I think that a lot of these tools can be used in a way that's consistent with support. Um, but as an example, when we teach a child to engage in deep breathing to cope with anxiety, um, the messaging around it is very important. Sometimes, at least in my work with parents, I see parents say, maybe they'll learn from the child's therapist, okay, they need to take deep breaths when they're anxious. And then when the child's anxious, the parent is kind of maybe sometimes anxiously like, okay, take your deep breaths. You got to do your breathing. Come on. And then what if the child doesn't want to do the breathing? I'm sure you all have heard this before. No, it doesn't help. I hate that strategy. Breathing is stupid. It doesn't work, right? What position does that put the parent in? A position where they have to either press harder. No, come on, just try it. Just take your breath. That's what your therapist said, right? And it could lead to like an escalating situation, right? Or a not very positive situation where now it's like, I'm trying to make you do your breathing, and then you're in trouble if you don't do your breathing, or the parent has to back away. Okay, that didn't work. I couldn't help you. Nothing can help you. You're still anxious, right? So that's a kind of like icky situation to put a parent or a teacher in. And it also isn't super consistent with support because it's kind of sending this like pressured message of like, you have to breathe to be okay. But the reality is, kids will be okay even if they don't do their deep breathing. And so, a more supportive way to present this kind of tool that also gets the parent out of that like sort of icky power struggle of like, I have to make you do this, um, is just to kind of say something more like, breathing can be something that helps cope with those anxious feelings a little bit easier or more quickly. If that's something you'd like to try, like I'm happy to walk you through it or do it with you. And if the child doesn't want to do it, like, okay, the message is still, you know what? That's all right. You will get through this moment anyways. So it takes the pressure off of the child, off of the teacher or parents. And again, ultimately aligns with that supportive message. So the bottom line here that we're really trying to convey is we don't need to fix anxiety. Anxiety is not a problem we need to fix in the moment. Ultimately, at its core, it is a natural human emotion, like I started this talk saying, and anxiety in and of itself, the experience, the feeling of anxiety is not dangerous. And it always passes no matter what. I always say, even if you're having like the worst panic attack, it feels horrible. It feels threatening. It feels dangerous, right? But it will pass. Even if you don't do anything special, even if you don't use a coping tool or a skill, it will pass. And that's why we really can say these supportive statements in a genuine way. This is such an important point, especially as we pivot back to this issue of accommodation, right? We talked about parent accommodation and sort of how natural and normal that is for parents to be pulled into accommodating their kids' anxiety. Of course they do. But of course, this happens at the school level as well. There's a lot of accommodation that goes on in the classroom. And the intention is excellent. The intention is to prevent or alleviate the anxiety. And like all school-based accommodations, it's also intended to promote better academic functioning, right? And to kind of level the playing field for students with disabilities, including anxiety disorders. Um, there are many, many different ways that we see accommodations pop up in the school setting. Um, I won't read through this whole list, and you have it on the, slides that you have a PDF of. Hopefully, you're thinking of many examples popping into your head too. Highlighting one from the case of B and Nasir, one way that we see teachers, especially having to accommodate a lot at school, is providing repeated reassurance or spending a lot of time answering questions, right? So that's a response to the child's anxiety. Again, this is not causing a child to be anxious, it's a response to anxiety, but we do have to question whether it's helpful or not. Um, this is my colleague and friend Tanya. She's a LCSW in a big Maryland public school district. I'll just let her talk for a minute about her experience of accommodations in her district.
Some of those things can include extensions of assignments, grade changes, like maybe having an incomplete, and then getting your grade changed to a different grade once you're able to complete the work. Home and hospital, where parents with the doctor's note are able to have their student at home while an instructor comes to the home to kind of instruct your child. Other things that are being asked for sometimes are either the parent or teacher are noticing that, oh, the child always misses like first period and second period, like algebra or language arts, there may be a request to change a child's schedule in order to kind of accommodate them coming in, maybe putting like a preferred class, either first or second period, to try to hook the child in to come into their favorite class or their favorite teacher, and then being able to kind of have them stay for the remainder of the day. Or modifying the schedule to be like, hey, you only have to come in starting at noon if the child is like sleeping or having like the somatic physical pain that's stopping them from participating. So some of the pros of that is that sometimes these things can be helpful to the parents or student as they're trying to figure out ways to like come in a way that feels, calming to like their body. And so some of the cons are that sometimes we at the school are like, hey, if they're having this amount of time, this amount of difficulty coming into school, if we're doing home and hospital, what's that transition going to look like? When it's time to come back into school, is that going to make it harder? Sometimes at the school, like we're not always able to kind of have that great working relationship with the doctor to figure out that transition plan, so that can be hard. Sometimes teachers are feeling sometimes upset or annoyed if they're having to do something different for this student versus what they're doing for the rest of the students, where they have that expectation of attendance and like work completion. Or sometimes, parents are asking for like extensions or like incompletes, and it's past like the grading period and they're not able to accommodate that, right? And feeling like now like there's like this power struggle between them and the parents.
So yeah, I think she sums up some of the really, first of all, tricky dynamics of deciding like,
Some of those,
are we going to accommodate or not? Who is responsible for making these decisions? Is it the school, the parents, the doctors? And some of like those dynamics between in the short term, these can work really well and these can be effective, but in the long term, is it setting up sort of um, this belief system really in the child and the family that like they can't handle anxiety very well, and it can lead to sort of more accommodations and more avoidance over time rather than less. I think for the sake of time, I'm going to skip my little research talk that I was going to go through here, but basically, we don't have as much research about accommodations of anxiety specifically in the schools. We have a lot of research on family accommodation of child anxiety at home, but the limited research that we do have is starting to support this emerging picture that Tanya was kind of getting at, which is that some accommodations, of course, can be really helpful, especially short term, to get a kid's functioning up to where it needs to be. But a lot of accommodations are inadvertently promoting more avoidant behaviors that actually are exacerbating the anxiety over time. Um, so I think, again, a sort of take-home message here is that not all accommodations are maybe super helpful or consistent with a supportive message, right? Some accommodations send this message that anxiety is not acceptable, it's not safe, we have to avoid it at all costs, right? But there are other accommodations that I think send a good message that, anxiety is acceptable, it can be tolerated, but it's hard, and so maybe we need to do a little tweak here and there to make it a little bit more tolerable to help you get through. I want to show one more video here. This is my pal Dave, who is a high school English teacher, talking about his attempts not to accommodate and sometimes the pressure or difficult dynamics he faces from parents.
In my English class, we do lots of class presentations, and students know throughout the year that a big project might be a class presentation. I work with students every year who have faced extreme anxiety to the degree that they go to the school psychologist and sometimes just almost can't bring themselves to do the presentation. But I've never had a child who couldn't go through with the presentations. We talk to them, we work with them, we guide them through it, we give them confidence. But we will still get calls from parents who are concerned on behalf of their anxious child asking us if their child just can't do the presentation, if we would exempt them from the presentation. And we know the parents mean well, but they're not actually helping their child in these situations. In fact, they're at odds with what we are doing in the classroom trying to help the student.
Yeah, so maybe again a separate talk about sort of some of the tricky dynamics in, you know, who makes the decisions about accommodating and sort of balancing and collaborating with parents. But again, I think what Dave is talking about captures the fact that there are some accommodations that are being implemented or requested by parents, by doctors, right, by the school itself that we have come to coin anxiety up accommodations, right? Excusing a student from a presentation overall might lead to more anxiety over time, again, because it facilitates that avoidance, right? That doesn't give the child the opportunity to actually see, you know what, I actually could get through this presentation, or this presentation wasn't as scary as I thought it would be, right? When you avoid, you never have the opportunity to learn that. And that can just reinforce your idea that, like, I have to avoid things in order to be okay. And that's going to keep you anxious, lead to more anxiety over time. Versus some other accommodations that we now coin anxiety down accommodations, which we think, again, can lead to sort of less anxiety over time and are more consistent with a supportive message. So here are some examples of other, common accommodations that we see. I'll go through like some of these quickly. Reducing a student's workload, providing extended time on assignments or tests, these can be sometimes anxiety up accommodations if the key problem is the child's anxiety rather than a challenge around their learning abilities or something like that. These accommodations can kind of be mismatched because they strengthen the belief that the child can't handle the anxiety and sort of reduce opportunities for the child to learn an important message. Like, for example, if a child is given extended time on assignments because they're just worried that they won't do the assignment perfectly enough and that will jeopardize their future college career, then they're never going to have opportunities to sort of maybe not complete an assignment and see that, well, you know what? I survived it. It didn't totally ruin my grade. I still have the chance to succeed in the future, right? Things like this. These are more examples of like probably what we would think of as anxiety down accommodations because they actually promote more positive coping. They don't provide a total escape hatch from the anxiety provoking situation, like breaking an assignment down into smaller chunks or pairing the student to work with a trusted partner. This does not facilitate total avoidance and still maybe sends the message you can handle what we're doing, right? But we acknowledge that this is hard for you. And so here's a strategy that might make it a little bit easier. Now, I want to put a huge disclaimer here, which maybe is overdue. And before we move on, that sort of as Dave was saying, as Tanya was saying, your hands are sometimes tied. First of all, that these, first of all, well, I'll do the disclaimers in two different orders. These answers are not universal, right? So for a child maybe who, is doing 0% of their homework and has been for months and months and months, maybe in the short term, providing some extended time on assignments or something is actually an anxiety down accommodation that gets them to actually approach their homework for the first time in months, right? So context matters. But again, thinking of just a child maybe who isn't stuck in that severe of a pattern, this could inadvertently create more avoidance and more anxiety. So these are not answers for all kids in all contexts, right? You have to consider the baseline level of functioning before you think of whether an accommodation is an up or down accommodation. My other disclaimer I was going to say is that it's not always up to you, to the school mental health provider, to the teacher, whether or not you accommodate. These things are written into IEPs, as you know, or 504 plans. And if you don't follow the accommodation, that's going to be illegal, right? So I understand that you have to sort of operate within your bounds when thinking of how can I maybe reduce accommodation or turn an accommodation into more of an anxiety down accommodation, right? But to the extent that you can, we believe that pairing support with anxiety down accommodations is kind of a winning formula for helping anxious kids. So I'm going to try to very quickly go through what we think is a nice approach. First, I think it's really helpful to clearly identify what the accommodation is and ensure that it's related to the anxiety and not an accommodation that's in place to help manage another challenge that the student needs to function and to level the playing field, right? So let's say a socially anxious student is getting excused from presentations, as Dave described. When we're thinking about how do we enact an anxiety down accommodation, we're focusing on our own behavior as adults. So, as a teacher, as a school-based provider, right? What can you do? We're not asking the child to do anything differently because that's more of a classic child-oriented CBT approach, right? Like, giving them exercises to work up to presenting. Now, what can we do to change our own behavior? And decide specifically what you will do and will not do that feels like a meaningful step forward and sends a supportive message. So maybe it's not totally excusing the child from the presentation, but maybe we're offering to practice with the child first or let you tape it first and review it or something like this. So again, it's not an escape hatch. It's not complete avoidance of the situation. It still acknowledges the child's difficulty. So it has that acceptance piece kind of baked in, but also has a little more confidence baked in that like you can handle and get through this presentation and the anxiety that it causes. So let's think again about B and Nasir. Hopefully you still sort of have that vignette in mind. I think there are some points to consider when B is deciding how can I respond a little differently and a little more supportively. First is Nasir's behavior stemming from anxiety. I think we established maybe, probably yes, right? Maybe GAD, maybe OCD. There's a good chance. Is B answering all of Nasir's questions as she has been doing and promised him to do an anxiety up or down accommodation? I would argue it's anxiety up because it sends the message like you won't be okay unless I answer all of your questions all the time, right? And it keeps him stuck in this cycle of feeling like he can only get through if he has all of his questions answered. And whose behavior should we focus on changing? I think B. It's in her control to decide how much she answers questions and in what way. When she told Nasir to limit his questions, not only did it feel, I think, invalidating for him, right? Because he can't choose just to turn off his anxiety, but it didn't work very well, right? He kind of tried to reduce his questions for a few days, but then, of course, they came back. So I think a winning formula here is for B to say something to Nasir like, I get it. It seems like you are so worried about getting your assignments just right. And that's making you anxious and it's leading you to ask me a lot of questions, but I am so sure you can handle these anxious feelings. And so, how about this? I'm going to start by answering one question per day for the next week, and we'll kind of go from there. So this is a pivot to an anxiety down accommodation, right? We're not completely taking away all support. She's still answering one question. That's a change in her behavior. She can decide how many questions she answers. She's not telling Nasir, you can't ask me any more questions, right? She's focusing on her own behavior change. Again, I think this still acknowledges his difficulty, but it's making a shift that's going to give him more opportunities to see that he can be okay, even if she doesn't answer all of his questions. For the sake of time, I think I am going to actually wrap up here. There are some other sort of tools and strategies that maybe are a little more intuitive things that folks are already doing that I think in general, teachers and school-based providers can do to create a more anxiety supportive environment that sends messages about like having anxiety and being able to get through at the same time, and anxiety being acceptable and safe and all of these great things. But I will stop here for questions. I've also provided some other resources. Ellie and I have a book coming out, it's not released yet, about how to manage anxiety in the classroom that kind of goes through some of the tools that I've talked about today. Also, I'll say too that, if you feel like any students that you work with could benefit from the kinds of approaches I've talked about today, please refer them to our program. We are enrolling kids in and their families in clinical trials right now where they can get services at no cost if they participate in our research. So with that, I'm going to stop my slides and see if there is time for a few questions.
Yes, here, I'm going to share my screen really quick.
Okay.
So then folks can have the, hopefully I do this correctly. All right, hopefully you all can see that. That has our contact information and the CEC request form. So I did take some chat questions in the chat as we were going.
Okay.
Some
Do a
folks had
speed round.
questions about attendance and getting students to school was discussed a lot in
Got
the
it.
chat. If there's
Yeah.
any recommendations on how to use space to help
Yes.
support that.
Yes. And I would say, if you want me to come back, we can do a whole other webinar on school refusal, I think. Because that's like one of the hardest challenges, right?
Absolutely.
If a child's in your classroom, there are tools you can use. If they're not in your classroom, what can we do? I will very briefly answer by directing you all to a video that is on YouTube. So go to YouTube and type in space school refusal or Ellie Leibovitz school refusal. My colleague Ellie, who I've mentioned, developed space, has kind of a space informed plan for addressing school refusal that I think is really fabulous. It's challenging, but school refusal is a challenging problem, so the solution's not going to feel super easy either. But I will encourage you to take a look at that video and see what you think. Okay.
And it looks like everyone would love to have you back. So maybe we can talk about something like this to launch the school year next fall.
All right.
There was a lot of questions about how to, recommend this to families and space providers. I think that's in the information that you shared.
Yeah.
Recommendations
website.
related to social anxiety or peer conflict, I think is something that folks see a lot.
Yeah, I think social anxiety is also one of the most challenging anxiety disorders to treat. And it's something that comes up a lot in schools, obviously, because it's going to touch so many areas. There's so many sort of performance aspects, peer interaction aspects in school. And so again, I think to the extent that you're seeing kids who seem like they're struggling with social anxiety, these supportive statements are just like a quick and easy tool in the moment. Like, it's a go-to response. It's kind of, I think of it as like a compass to guide you on how to respond. You don't need to try to talk a child out of their feelings or convince them to do something. It's just like, hey, I know it can feel very scary to like interact with your peers or to do the presentation, but like I think you're a kid who's capable of handling those scary feelings, and maybe thinking about again how much you're facilitating total avoidance versus sending the message like, how can we find a way to approach this situation that's a little more comfortable, thinking about your role, what you're doing to facilitate it in one direction or the other. So without some more specific examples, maybe that's not a satisfying answer, but it's basically the approach we've laid out.
Thank you. And just so folks I'm trying to go through some of these last slides as we're all this information is in your in the PowerPoint, but some final slides and other opportunities. And again, we've got the CEC request form and the course evaluation. So thank you all so much for joining us. Thank you so much, Dr. Etkin. This has been so informative. I don't know if you can see in the chat, but everyone is so thankful. And this is such great and practical knowledge, I think, that schools can really implement. So thank you again so much. And thank you all for taking the time out to join us this morning. I'm going to put in the chat again. I just saw a request for the links for the CEC request form, the course evaluation. I will put that right.
Thank you. Thank you, Kate, and thank you all so much.
All right. Thank you all. Have a great morning. Everything will be emailed out in the next couple of days once I get the final email list of participants. So please keep an eye out for that. And if you have any questions, feel free to reach out. We hope that you will join us in April. We have Dr. Robert Ketter is joining us to look at beyond behavior, focusing on supporting emotional regulation in school. So that should be another great topic for us. So thank you all so much and take care.
Bye, everyone. Thank you.